Hi friends, welcome to Plexus Ortho. My name is Dr. Kanan Kumar. Today we are going to talk about nerve entrapment syndromes in the body. This is frequently asked in your NEET PG exam, so you must know a little bit about this. So let's quickly get on with the topic. So the first nerve entrapment that we're going to talk about is a very commonly asked syndrome, carpal tunnel syndrome. What is a carpal tunnel syndrome? It is the compression of the median nerve. It is the compression of the median nerve at the level of the wrist, right? So basically it's a compression of the median nerve at the level of the wrist. So what are the components of the carpal tunnel? There are 9 tendons. What are the 9 tendons? There are 4 FDS tendons, 4 FDP tendons, 1 FPL tendon, flexor pollicis longus, and then there is the median nerve, right? So what are the symptoms of a carpal tunnel syndrome? The most common symptoms are night symptoms. They have numbness and tingling in the 3.5 lateral fingers, that is the thumb, index finger, middle finger, and the radial half of the ring finger is affected in carpal tunnel syndrome. What are the tests that you can do? You can do what is called as a Fallon's test, where you keep your hands or wrist in dorsiflexion for about 60 seconds. It will reproduce the symptoms of the carpal tunnel syndrome. You can also do a Durkan's test, where you compress the wrist with the help of the examiner's thumb, and you can reproduce the symptoms. So which is the most specific and sensitive test for carpal tunnel syndrome? It is Durkan's test. So Durkan's test is the most specific and sensitive test for carpal tunnel syndrome, right? So carpal tunnel syndrome is basically median nerve compression at the level of the carpal tunnel. So what is the next syndrome that we're going to discuss about? We're going to discuss about Pronator syndrome. Pronator syndrome is the median nerve compression in the arm and the forearm. So median nerve compression in the arm and forearm is called as median nerve compression in the arm and forearm is called as Pronator syndrome. What are the structures that can cause compression of the median nerve in the arm and forearm? In the arm, you can get compression from the Struthers ligament. Struthers arcade is different, Struthers ligament is different. Struthers ligament is the one which causes compression of the median nerve, whereas arcade of Struthers causes compression of the ulnar nerve. Arcade of Struthers causes compression of the ulnar nerve. So this is the first structure that can cause a compression of the median nerve in the arm. What is the other structure that can cause a compression of the median nerve? It's a laceratus fibrosis. What is a laceratus fibrosis? It's a facial tissue which comes from the medial aspect of the biceps and inserts into the deep fascia of the forearm. That is called the laceratus fibrosis, and this here also the median nerve can get compressed. Where else can it get compressed? It can get compressed under the arch of the FDP or FDS, that is flexor digitorum superficialis. Can also compress the median nerve. The leading edge of the flexor digitorum superficialis can also compress the median nerve. It can also get compressed between the two heads of the pronator teres. Where are the various locations where the median nerve can get compressed in the arm and forearm? One is the Struthers ligament. The second one is the laceratus fibrosis. Third one is the leading edge of the fascia of the flexor digitorum superficialis, and between the two heads of the pronator teres. So pronator syndrome is not only the compression of the median nerve in the pronator teres, but all these structures can also cause compression of the median nerve. Okay, so pronator syndrome is compression of the median nerve at the arm and forearm, whereas carpal tunnel syndrome is the compression of the median nerve at the carpal tunnel. Now let's come to the cubital tunnel syndrome. In the cubital tunnel syndrome, the ulnar nerve is compressed behind the medial epicondyle. So what are the borders of the cubital tunnel? The posterior border is formed by the medial oblique portion of the medial collateral ligament, right? The other boundaries of the cubital tunnel include the medial epicondyle and the olecranon, right? And then the roof of the cubital tunnel is formed by what is known as Osborn's fascia. The roof is formed by the Osborn's fascia. Osborn's fascia. The ulnar nerve commonly gets compressed in this area, and this is called the cubital tunnel syndrome. So this is called as cubital tunnel syndrome, and this is where the ulnar nerve can get compressed. So we have to release the Osborn's fascia to decompress the nerve, right? Then you have the Guyon's canal syndrome. Guyon's canal syndrome is also an ulnar nerve compression, but this ulnar nerve compression occurs at the level of the wrist. So we know there is a carpal tunnel in the wrist, but there is also a tunnel through which the ulnar nerve goes in, and the boundaries of this tunnel are pisiform forms the ulnar border. The hook of hamate forms the radial border, and these two are covered by what is called as a palmar carpal ligament, and the floor is formed by the flexor retinaculum. So when you have an axial section, this is how it looks like. This is the pisiform, right? And this is the hook of the hamate. And this is the hook of the hamate, and this is the transverse carpal ligament. Transverse carpal ligament, and here you have the carpal tunnels contents, and then there is a palmar carpal ligament, and here you have the Guyon's canal. This is called the Guyon's canal, where you have the ulnar artery, then you have the ulnar nerve and the ulnar nerve. So these are the contents of the Guyon's canal, and these are the borders of the Guyon's canal. Any compression of the nerve at this level can cause numbness in the ulnar 1.5 fingers, that is a little finger, and the radial ulnar half of the ring finger. And it can also cause intrinsic muscle damage. What are the intrinsic muscles supplied by the ulnar nerve? So it supplies the adductor pollicis, palmar intraossei, dorsal intraossei, and the medial 2 lumbricals. The lateral 2 lumbricals and the other 3 thenar muscles like opponent's pollicis, abductor pollicis brevis, and flexor pollicis brevis. These are the 3 muscles which are supplied by the median nerve. So all these muscles are affected in Guyon's canal syndrome. What is the most common cause of Guyon's canal syndrome? There may be a cyst formation in the wrist joint which presses on the ulnar nerve and causes this Guyon's canal syndrome. So cubital tunnel syndrome is at the level of the elbow because of the Osborn's fascia which is pressing on the ulnar nerve, whereas a Guyon's canal syndrome is at the wrist because of compression of the ulnar nerve at the level of the wrist. Then we have the thoracic outlet syndrome. All of you know this very well. Thoracic outlet syndrome is the most commonly compression of the C8 and T1 nerve roots along with the neurovascular bundle like the subclavian artery and the vein, and this gets compressed between the clavicle and the cervical rib or the first rib. So when it gets compressed here, patient will recreate the symptoms of numbness, tingling and numbness in the little finger, because C8 is the little finger, right? The thumb is C6 dermatome, middle finger is C7, and the little finger is C8 dermatome. And these tests can be reproduced by the Adams test, the Roux test, and other maneuvers are available to test this thoracic outlet syndrome. So whenever the patient abducts the arm high above the shoulder, the neurovascular bundle, the subclavian artery and the vein get compressed between the rib and the clavicle bone, and therefore you have what is called as the thoracic outlet syndrome. Next, coming to the lower limb, a few of the lower limb syndromes. Piriformis syndrome. Piriformis syndrome, when the sciatic nerve gets caught behind the piriformis muscle. So the sciatic nerve comes out of the greater sciatic notch and gets compressed or goes beneath the piriformis and then comes over the short external rotators of the hip joint. So when it is under the piriformis muscle, it can get compressed here. And what is a maneuver which compresses the sciatic nerve? It is called the flexion, adduction and internal rotation, FADIR. Flexion, adduction and internal rotation of the hip can cause compression of the sciatic nerve by the piriformis muscle, and this is called as piriformis syndrome, which involves compression of the sciatic nerve. So next one is the Meralgia Paresthetica. Meralgia Paresthetica is the compression of the lateral cutaneous nerve of the thigh. All these syndromes have been previously asked in your exams, so you must be thorough with these so that you don't miss any points or marks because of these syndromes. So lateral cutaneous nerve of thigh compression can cause Meralgia Paresthetica or numbness and tingling and numbness in the lateral portion of the thigh. The reasons for compression are various, including tight bandage, tight underwear, some kind of surgery done in that area, or compressive neuropathy because of lying down on that side. So all these can cause lateral cutaneous nerve of thigh compression, and this is called as Meralgia Paresthetica. Similar to that is the Chieralgia Paresthetica. Chieralgia Paresthetica or Wartenberg syndrome. It is also called as Wartenberg syndrome. Occurs because of compression of the superficial radial nerve at the level of the distal forearm or wrist area. So when you wear a very tight watch, or a prisoner is pulled around with a very tight cuff links, or that links which the prisoners use, it can cause compression of the superficial radial nerve, and this is called as Chieralgia Paresthetica. It causes numbness over the first web space, which is autonomous zone for the superficial radial nerve. What is autonomous zone for the median nerve? Tip of the volar tip of the index finger. What is the autonomous zone for the ulnar nerve? Volar tip of the little finger. So when there is a compression of this nerve, the superficial radial nerve, because of a tight watch or because of some kind of compression there, it can cause numbness in the first web space, and this is called as Chieralgia Paresthetica or Wartenberg syndrome. Next, coming to the foot, what is called as tarsal tunnel syndrome. Tarsal tunnel syndrome is compression of the posterior tibial nerve, compression of the posterior tibial nerve in the tarsal tunnel is called as tarsal tunnel syndrome. So what are the contents of the tarsal tunnel? The contents of the tarsal tunnel include posterior tibial nerve, right? Then posterior tibial artery, flexor hallucis longus, flexor digitorum longus, and tibialis posterior. So what are the contents of the tarsal tunnel here? Is first thing is posterior tibial nerve, posterior tibial artery, flexor hallucis longus, flexor digitorum longus, and tibialis posterior. So compression of this posterior tibial nerve can cause tingling and numbness over the most of the sole and a little bit in the medial portion of the ankle as well. It also can cause intrinsic weakness and wasting and burning sensation in the foot of the sole. What will you also have? You have something called as a Tinel sign. That is when you tap proximal to the compression site, there is a current shock-like sensation in the area supplied by the posterior tibial nerve. This is called as Tinel sign. We will go into more details in other videos, but for now, tarsal tunnel syndrome is basically compression of the posterior tibial nerve in the tarsal tunnel. Next, last but not the least, is the Morton's metatarsalgia. Morton's metatarsalgia is the interdigital nerve that is compressed in the third and fourth web space. So third and fourth interdigital nerves which are compressed is called as Morton's neuralgia, Morton's metatarsalgia, or Morton's neuroma. This also has been asked very frequently in your exam. The treatment here is conservative initially, and then you may have to do surgical excision if there is no relief with conservative management. So that is in brief about the nerve entrapments in the body. I think there are a couple, 2-3 more which have been missed, but this is the general or the most common ones that they usually ask. So to briefly recap on all these syndromes, carpal tunnel syndrome is a median nerve compression at the level of the wrist or at the level of the carpal tunnel. Pronator syndrome is compression of the median nerve at the level of the arm and forearm. Cubital tunnel syndrome is compression of the ulnar nerve at the level of the cubital tunnel or at the level of the elbow. Guyon's canal syndrome is compression of the ulnar nerve at the level of the wrist joint or in the Guyon's canal. Thoracic outlet syndrome is compression of the brachial plexus between the clavicle and the first rib or the cervical rib. Piriformis syndrome is compression of the sciatic nerve behind the piriformis muscle. Meralgia Paresthetica is compression of the lateral cutaneous nerve of the thigh. And Chieralgia Paresthetica is compression of the superficial radial nerve at the level of the distal forearm and the wrist. Then the tarsal tunnel syndrome is compression of the posterior tibial nerve at the level of the tarsal tunnel. Morton's metatarsalgia is the compression of the interdigital nerves of the foot between the third and the fourth web spaces. So with that, we have concluded nerve entrapments in the body for NEET PG. Hopefully this helped you. Kindly subscribe to our channel for more such videos. Thank you for hearing me out. My name is Dr. Kannan Kumar and this is Plexus Ortho.